So we're going to do the turf toe taping, and that's going to be on the plantar aspect of our foot, trying to assist when there is an arch issue or maybe shin splints and we need to lift the arch and provide more support for our patient. So a couple things that are important to do. You don't have to have pre-wrap because there is no hair on the bottom of the foot and usually minimal on the top. But for the tape to stick a little better, a lot of times we use tape adhesive such as this, and we would spray that so that the tape really sticks well, because the foot does tend to sweat and the tape can come off for that reason. So we want to do this underneath the sock directly on the skin, and the first thing you want to do is place your anchor in the appropriate location. When you're taping a patient for the foot, you can have them in the slight plantar flexion, seated on a table with their leg stretched out into extension, and you want to be seated in a chair because you want their foot to be at eye level and to where you have the greatest ability to move around and greatest mobility for yourself. So what we're going to do is we're going to place the anchor slightly across that metatarsal. You can see the metatarsals kind of go in a circle or half circle, semicircle. But we want to just cut across that, and if I go up here, it's going to get into the toes. So I want to make the best judgment of where I can do that horizontal anchor line. So it looks like it's going to be right there. So I'm going to take that, and with her foot bent back a little bit, I'm going to wrap it directly around and underneath the base of that fifth metatarsal. Nice and gentle. It's not really supposed to be super tense, and then I can kind of smooth it out. The rest of it, relax, I can do with her in that slight plantar flex position, or I could ask her to stay here. So I'll ask her to stay here so we can see it a little bit better. And what I'm going to do is tear my tape 1.5 inches in half, and there'll be one side that's a little bit wider than the other. I like to use the thinner side, but it's really just personal preference. This is the X arch tape. So the tape is going to crisscross and make X movements based on the toe alignments. So I'll show you how we can start that. We're going to start it at the base of the fifth metatarsal, which is right here on our anchor. We're going to go down and around, creating tension from this angle to recreate the arch, and then back up to recreate that longitudinal arch. So I'm going to line it up with the base of my fifth metatarsal, smooth it out as I go along. If it's not sticking, just re-stick it. Lay it down, smooth it out. Around the Achilles, you want to be very careful. The Achilles tendon attaches right here, and if you pull really tight without thinking about it, you have to be extra gentle, because if you don't think about it, you're going to cause that Achilles tendon to be irritated, and they could possibly end up with Achilles tendonitis or just a blister there. Sometimes we put a heel and lace pad here for that reason. And come up and across. The tension, I wait to pull when the tape is already on the side of the heel. So it's not behind here anymore in the Achilles region, it's up here. And that tension now is going to go from this part of the tape upward. And I'm going to set it at the base of the first metatarsal, and I work my way back up, smooth it out so it's attached to the skin, because that's really important. The next one I'm going to do is going to be completely different. I'm going to start at the fourth metatarsal, and I'm going to line it up with the second metatarsal. So we just did fifth and first, now we're going to do second and fourth. So I line it up with the second metatarsal, staying on my anchor, go down and around, pulling, lighten up a little bit around the Achilles, just lay it on. And then now, once I get enough on the Achilles, I'm going to now create that tension and pull up across to the second metatarsal. So you can see how it's fanning naturally. The next one I'm going to do is the third metatarsal to the third metatarsal. So now it's the third right in the middle. I come up and under, smooth that out, just lay that on behind the heel. Now I'm pulling pretty tight back to that third metatarsal. Make sure you smooth it out, otherwise it bunches up and then they're just going to have a lot of pain. What I'm going to do now is repeat the entire cycle again backwards. So I'm going to do third to third. I'm going to go a little quicker this time just to show you what it would really be like. Second, we're going fourth to second. You can see all the X's that are being created now. Fifth, smoothing it out to first. And now that I have that, I'll go back to my 1.5 inch tape and I will create my anchor again around the foot. One of the key factors is you don't want this. So what I'm going to do is just go a little bit below that base of the fifth, making sure not to actually go at the base of the fifth so I don't irritate that toe, and come back and across here. What I'm going to do is I'm going to create a little extra arch support by placing some tape along the entire arch. So you go about halfway down and you're creating these little horseshoe type strips or C strips, lifting as you apply. This will actually, the patient will feel a lot better because you're lifting their arch. I'll do one more just to cover that bottom portion. And that is our X arch taping.